Good morning. Welcome to the second sort of breakout session today. You are here, hot off the press, for an exclusive on the Health and Wellbeing research report that's just been published today. And it's looking at leveraging digital innovation to improve the employee experience and drive better health outcomes. And this is a collaboration between REBA and Axa Health. So before I introduce our speakers, a few housekeeping notes. Questions? Please, as the speakers are speaking, put them on Slido and then we can look at them afterwards. It'll be 20 minutes presentation and then 20 minutes for Q&A. Also at the end, just a reminder, if you could rate sessions as well, it's really useful feedback for REBA for future events. So then, without further ado, please let me introduce you to our Axa Health speakers. We have Sarah Goodwin, Head of Strategy, and Francesca Bennett, Wellbeing Proposition Lead and Service Design. And yeah, get your questions ready. Thank you.
Thank you, everybody, for coming. You will soon see when Fran joins the stage that we haven't made it easy for you because we've got the same hair. So I am the Sarah of Sarah and Fran. And as you just heard in that introduction, I lead the strategy team at Axa Health. And actually, we've come here today to share some of the insights in this report that I'll also wave around as we're talking, but also some of the practical examples of how we are really embedding what it is that we're doing and what we're hearing in this report within some of the services in Axa Health, and hopefully we'll leave you with a couple of things to take away, to think about in terms of how you build this into your offers and the things that you provide for your employees. So, I feel a little bit of a fraud starting with this slide. For those of you who came to Professor Hannah Fry's keynote this morning, this is a slide about AI. For those of you that were there, I have nothing that can compete with that, but I'm going to give it a good go. Whilst we're talking about digital and tech today, we've shown this, which actually we've adapted from a company called the Medical Futurists, to show quite how many things are evolving in our world about how AI will further enhance healthcare delivery. As I say, we're not going to spend a great deal of time on this today, but we use this as context to really show you the pace of change in the world in which we're operating in healthcare. Some of these might feel a bit scary, particularly those at the bottom that are considered a bit more high risk. But actually, if you start to look, you start to see some themes coming out in here. Firstly, that AI can really help us to understand patient needs, really understand at the heart of it what they are looking for and where they need our help. Really good for predicting health trends, seeing what's coming down the line, and developing really targeted interventions when you know what it is that somebody needs. So as I say, today, we're not going to go into this in a great deal of depth. We're going to talk about digital as a foundation. But for me, in a strategy role, I would be really remiss to do a presentation without mentioning AI, but also just to show you the pace of change and how digital lays the foundation for being able to access some of these things in the future. You'll see a couple that are highlighted in a kind of darker blue colour. Those are the ones that within Axa we're already working on, particularly to do with resource allocation, planning, and really trying to make sure that we make our services as effective as possible. So let's start getting into the data in this report, which, as a reminder, if you want a lovely printed copy like this, please head to stand 18, where Anne and the team will give you a lovely copy to take home with you. But we thought we'd share some of that data and how it's setting the scene. So if you look to the left of this, firstly, you'll see that there's a couple of factors that come out really strongly about how digital healthcare can help manage the cost of care over the next few years. Two big themes here. First, about early care. So I think a lot of respondents here are talking about GP services and some of those frontline services that really do help people get the care they need. And secondly, we refer to within Axa Health as online outpatient services. And I'll come back to that one later in terms of what we mean. But those results are really positive in terms of actually respondents to this survey really seeing the opportunity that digital provides to manage the cost of care. In terms of how that will happen, if you look to the right-hand side, there's kind of two broad themes of areas. You've got your really well-established services at the bottom of GP, mental health and EAP, and we'll talk a little later with Fran about mental health and EAP in particular. They are really well-established across our industry in a way that we probably couldn't have thought that they would be even 5 years ago. But if you then look to the top of that, there's definitely some areas where people really see advancements coming over the next few years. All to do with personalised services, triage, and much more to do with actually moving from mental health settings into physical health settings. So the theme that we're getting from this data is a real broadening of where technology and digital can be used to deliver impact. And then if we look at the impact, I asked my team when we pulled this slide together whether this was just the top benefits that people see, and I was reliably informed this was all of the benefits. So everything scored over a 3 out of 5 in terms of the impact that we're expecting from this. Expectations are high. To want benefit across that many different fronts over the coming years, that's a real opportunity that actually this community sees, which is fantastic, but also a real challenge to get it right. So if we dig into some of those areas in particular, we're actually quite reassured to see speed at the top there. That's at the heart of private healthcare. That's at the heart of what we do as Axa Health. And we believe, and we'll come on to it in a little bit, that actually digital tools and technology allows us to really manage the supply chain effectively to respond to that core truth. There's also a theme in here around making sure that we're getting the right care for the right individual. A lot of that we are looking at is triage and making sure that we know what it is that patient needs and getting them that help. But there's also a theme in here around inclusivity, personalisation, and also implementing at scale. You guys in this room know better than many others about how the changing landscape of work makes delivering those benefits more challenging into the future. We believe, as clearly the respondents in our survey believe, that digital tools help with that challenge and help meet those employees where they are. The other thing that came out that's not on this slide is that engagement with these services remains the #1 metric, the #1 metric that people are looking for to see whether or not they are working for your workforce. So as I say, we've got some high expectations as a community in terms of what these services can deliver and across quite a lot of different fronts, and that's what we want to spend a little bit of time thinking about today. So within Axa Health, we talk a lot about our job is to provide the right care at the right time. And really critically, that means in some cases, digital and technology-enabled solutions are the right care for that patient. In other areas, they aren't. So our solution is always going to be a blended solution, always going to be about finding those areas where digital really can have impact, and also those areas where perhaps it's not safe to do so. Perhaps it's not what customers want, it's not what your employees want, and trying to find that area in the middle that works for everybody. We've talked about a couple of the benefits that are seen in the responses to our survey, but just to pick out a few more that we see as a provider perspective. Firstly, that blended care really helps us to protect that relationship with a clinician. We call it relational care. Every bit of research we do, including a new bit that I got in this week, really talks about how important that relationship with a clinician is. And whilst digital might seem that it can't do that, actually you'll see from some of our services, it strengthens that patient-clinician relationship because it is where the patient really needs that help and it's really targeted to what they need. I think it can also be really easy to skip over the convenience factor. We take it for granted, right? You can do this from home, you can do this when you need to, but actually it is a critical success factor, particularly for employee benefit services. We see a lot of people using this outside of work hours, taking the time that they need to be able to speak to a clinician without needing to take time out of the workforce. So we can kind of skip over the convenience of digital services because we're all used to it, but it is absolutely a huge part of the benefit that we can provide. The other areas that we really see the benefit are around the standardization of the information we collect from our patients. Now that sounds on the face of it really boring, but we'll come into it in a little bit. But that standardization, really asking you all the questions that we need to ask you about what is wrong and how it's impacting your life, transforms the ability of our clinicians to give you the right outcome. So I'll speak a little bit later about our services with HBS UK. If you speak to the Chief Medical Officer of HBS UK, he remembers a lecture from when he was first at medical school, where an eminent professor, who I cannot remember the name of, told him that in 90% of cases, with a really accurate patient history, you can make a diagnosis. In 90% of cases, it's all about the questions you ask that patient, being really targeted, really about the thing that they are suffering from and how it is impacting their life. So ultimately, he gives an example about how much you know about a cardiac issue with a patient from some really targeted questions about whether they get out of breath walking up or downstairs. You don't need to send them for an ECG. You don't need to do all of those things. Asking questions about how it's impacting their life gives you the information you need in order to know what is likely wrong with that patient and get them the help much more quickly. And then in terms of timely data, actually, what we see is we now know how this service is performing and how patients are kind of accessing this service and how they feel about that service much, much more quickly than we can in a more traditional face-to-face model, where we, as the insurer, only get the invoice down the line. And then we have to analyse that data and work out how that's going. We get in-the-moment feedback about how these services are being delivered, and as you'll see later, how patients feel about them when they go through them, which means we as a provider can act more quickly to make changes if we need to, but you guys as benefit providers can also really see if it's working or not in a way that is quite difficult in face-to-face. So if I briefly move on to how our HBS UK services work, this is an example from our Muscles, Bones and Joints online outpatient service, which we've had for about 5 or 6 years now and is the most established of all of our services. We acquired HBS, who provided this for us last year, because we really see the potential in this service, and I'll come on to later how we've broadened that out. But essentially, it starts on the left-hand side with accessing a really quite detailed patient capture form. And that is developed with a panel of expert clinicians in that field. So in this case, we got a load of people together who are absolute experts from an orthopaedic perspective. To say, imagine a patient is sat in front of you, what are the questions that you would ask them? And we standardise it and we push it. And this is a dynamic way of capturing that data to get that richness of patient history. Those panels then review that, refine that, but ultimately that is the key to unlocking a lot of this. And when we first looked at this journey, you might look at this and think, actually, that's a lot of information that we're asking from a patient. That's quite a long form. Actually, we get brilliant patient engagement with it. We have a lot of free text boxes in there to allow patients to really tell us how this issue is impacting their life. And actually, in some cases, they reach the text character limit. Right? Patients really want to feel heard. They don't want those first 2 minutes in a consultation where a doctor says, right, tell me a little bit about what's going on. We find people actually spend time going through, telling us what their issue is. You'll see later that we've launched this into a dermatology service. If we ask a patient to upload a picture of the issue, I'll tell you we get 6 different pictures from different angles and different lighting to really, really make sure that that patient gets across to the clinician what it is that's going on with them. So we see really, really good patient engagement on the left-hand side, which allows those clinicians to review those cases, contact the customer through a video consultation if they need some more information, and ultimately decide what the right next step is for that patient. It might be that they do need some diagnostics. They do need to be sent for a scan. We'll book that for them, and we'll send that patient up to a physical location to get that scan. And then what we can do is in the follow-up consultation, share that scan with the patient. Circle it, show you the bit that we're talking about, show you the area that's really impacting you. And actually, increasingly, we're looking at more interesting ways to deliver those diagnostics. And then we'll let you know, with that clinician, what the next best step is for you in terms of treatment or in terms of education and information that you need to move forward. And ultimately, a discharge where we'll ask that satisfaction survey that I'll come back to in a second. So as I say, this is an example from our Muscles, Bones and Joints pathway. That's been live for about 5 years now. So we've got our richest data about the impact this is delivering on the cost of care that we can deliver. Ultimately, it is removing and reducing low-value interventions for our patients. Removing the steps that actually are not helping them to get better and not helping them to get better most quickly and effectively. So on the left, you'll see that actually a lot less people need a consultation with a specialist. That's because we know from the information they provide that a physiotherapist or an advanced physiotherapist is absolutely adequately trained to help them with what they need. And that allows us to manage the consultations that we have with those really deep specialists where they're really needed, and we can get the patient to them quicker. We also see less pathology in scanning. So the clinicians that we work with don't tick every box on that field. They really think about what it is that they need to know in order to get your diagnosis better. And ultimately, we see all of that flowing through to less treatment in some cases because it's not what the patient needs. Particularly in muscles, bones and joints, a huge amount of benefit can be found from some really well-followed physio advice and some physiotherapy, rather than needing to go straight into a joint injection that is quite often used as a kind of quick fix, but also the hospital treatment such as a joint replacement. But it's not just about cost. So these are some of the benefits that we see that are much broader than that in terms of how our patients interact with those. So again, on the left, you'll see our muscles, bones and joints. We're putting 17,000 patients a month through that journey. And ultimately, 92% of those, to my point earlier, actually see a physio first because that's the right first step for them. And one of the scores we're most proud of there is that score at the bottom of a PREMS score, a patient-reported experience measure, PREMS, which is a 4.6 out of 5. So whilst these patients are seeing a different clinician to the one they might expect, they're telling us that it gets them what they need. And actually, we see the best results in the question that said, did you feel heard? Did you feel heard about what this issue was and how it was impacting your life? Which goes back to the depth of that questionnaire earlier. Our data's a bit earlier on in terms of digestive health and dermatology, because these are newer services for us, but to pull out a couple of areas. Actually, in digestive health, you need more testing. But at the bottom there, it should say 46%. But ultimately, what that means is of the half of the patients that we send for tests, half of those ultimately are reassured after that test that they have nothing to worry about and are sent home with guidance and reassurance. That's 1 in 4 that don't actually need the treatment that perhaps they feared they did, and we get them a brilliant outcome from it. And then in terms of dermatology, the ones that we're most excited about are quite how quickly we're able to do that case review, quite how quickly a dermatologist is able to look at your case. To put that in contrast, actually some of our wait times in certain areas of the country for a private dermatologist are up to 8 weeks. That's less than half a day to be able to do that, because actually we can connect you with a dermatologist somewhere else in the country. The one area we're still working on at the bottom is around how many we're still sending face-to-face. We're working on what we call a dermoscopy network. So how do we get that really high-quality imaging in places that are really convenient for our patients, and then we'll expect that face-to-face number to drop. As you'll see at the bottom, we're working on the next ones to do with cardiology, neurology and urology, which I'm sure my team have put in that order because that's really hard to say, but they are the ones that are following. So that's our services with HBS, and now I'd like to welcome my colleague Fran, who's going to talk about how we're using this in mental health.
Thank you. Thanks, Sarah. So Sarah's talked a lot about the medical treatment side of things, but we're increasingly seeing health looking more like it's on a journey and a continuum, from health awareness all the way through to some of those medical treatments and support. You'll know the challenges that you're all facing. Aging workforce, those with ill health, so they're leaving the actual workforce themselves, or they're attempting to balance that kind of chronic and lifestyle health conditions. While some of this is actually out of your control, the return from a well-implemented preventative strategy can start to mitigate some of those risks. When it's underpinned by digital, it can really increase the effectiveness of how those activities are actually deployed. Traditional health screening programs can have a really limited reach. They really often focus on those senior level employees. And so cost, resource and geography all have to start to become some of the considerations when we're looking at some of those activities you're going to undertake. An online or short form assessment, for example, can offer an opportunity for employees to take stock of where their health is at and encourage and empower them to take some health responsibility for themselves. You'll see health responsibility come out quite a bit in the report because it's important. We can lead a horse to water, but you can't always make them drink. So encouraging people to do that is a really key point. Different people engage differently. We are all different. The fit and healthy, they're more likely to engage in some of those health assessments, on-site activities. It's always nice to be told we're doing a good job. For others, though, we've heard anecdotally that they already know they're overweight. They don't need someone to tell them that. So sitting down in a health assessment that could be 3 hours long can feel really daunting and a real barrier for them to actually even getting some support that actually would make a real difference to them. That's where we think that digital can actually be really powerful. It starts to remove some of that barrier. It allows them to engage at a time that suits them. It's still helping them to understand and take responsibility for their health, but it's on their terms. An effective programme really does start to offer some scale to that. It allows you to reach that wider population, looking more towards whole of workforce as opposed to that kind of top tier of senior employees. It also helps you start to identify some of those risks, and actually you can then start to think about where do you want to spend your investment? How can you get the most impact to support those people? And that covers from both mental all the way through to physical health. We saw on some of the slides that Sarah shared, whilst mental health is really established, physical health does have a huge impact. And so starting to tackle both is really key. If I use our digital assessment as an example, an employee can complete that whenever it suits them. So it could be they're at work, it could be they're on the train home, it could be they finally sat down for a cup of tea and they actually have time to think about themselves for a change. We really focused on 3 pillars when we delivered this, so mind, body and life. The question set is designed with clinical rigour, it's based on all the health research and it's thoroughly tested. But most critically, it's offering automated but personalised reporting. It's going to span anything from content to self-support management, all the way through to then connecting employees with those kind of targeted support interventions. It could be that we're sending them towards the EAP for some extra mental health support, or it could be we're leading them more towards the evolution of health coaching. Connecting individuals to relational support and better connecting the benefits is one of the meaningful ways that staff can start to really interact with your models. It's why we built our health score, and it's one of the reasons why we include it as part of our freemium for a lot of our packages. I wanted to touch more on where the technology is helping employees get to that specialist support, really focusing in on some of the EAP service. It means that we can then actually offer people the help at the right time and with a more personalised experience. I'll cover off some EAP, but I will then touch on evolution of coaching as well. I mentioned earlier that everyone interacts differently, particularly when it comes to mental health. We can all know it can be really hard to start that conversation. You have to feel comfortable, and really that's one of the keys to actually opening up and kind of getting some support that you may need. When booking a mental health consultation, we use a best match clinician selection. So it enables an employee to see who that person is, what do they specialise in. It also means that we're trying to bring someone forward who's got the best specialism for them. So we give a bit of information about themselves, and actually we can start to kind of push forward those people who they might connect better with. We know that actually matching those clinicians and the employees means that you're more likely to feel more comfortable, and that really enhances that counselling experience. It's just one of the ways we've started to introduce some of that digital capability, not replacing, but enhancing that human connection, essentially. Health and wellbeing coaching is relatively new. It offers some really useful interventions, though, from both a clinical and a subclinical perspective. It's a term that's banded around quite a lot and can mean a lot of different things. But what we're really focusing in on is actually kind of how it can enhance those kind of subclinical and clinical conditions. Given the makeup and the geography involved, the digital components that play a part in this can really start to connect a coach with an employee no matter where they are. We all know we work in a huge variety of places, and hybrid has become kind of the norm, essentially. So it starts to enable us to do that. You don't have to just go in to see someone for a face-to-face appointment. We've seen some real big successes in terms of health coaching for supporting the health management of both the precursors of conditions, so things like type 2 diabetes, as well as actually their long-term management, so helping to manage some of those symptoms and kind of the condition itself. Actually, for type 2 diabetes, this has been rolled into a number of the NHS trusts, and another has used health coaching to support rehabilitation wards, which they've suggested has an indicative cost saving of 3 million, which seems quite a lot. We currently have 2 models, one to support people with risks, which I've kind of touched on, developing support for those with either physical or mental wellbeing needs, essentially. And the second is offering coaching for those who've been diagnosed with cancer. It's all digitally enabled, so supporting employees to choose a coach, and again, similar to the EAP side, matching them with someone who they would like to work with, means that they can connect, overcoming all those geography and the things that Sarah mentioned to do with convenience and fitting into all of our busier lives. The focus of coaching really is setting personalised goals with health-related outcomes. So health coaches are experts in behaviour change. They provide the support to increase someone's self-efficacy, their motivation and confidence, which are some of the most important elements. It also helps people to then commit to that lasting change, which then essentially is going to support and improve their health. It could be anything from getting more sunlight when you first wake up in the morning, going for a walk a bit more so you're increasing your steps, or just having one less biscuit with your cup of tea, for example. Good design and personalised support with connectivity and tracking really does help to improve and help people to take responsibility for their health. If you are looking towards targeted interventions, coaching can really help alongside an assessment programme because it targets those people who actually you want to spend a little bit more on to start to minimise some of those risks. We've previously presented some of the great data behind our own service, which you can see up on screen. The impact of counselling is more personal to the individual, and that's materialised in some of our customer satisfaction and the NPS scoring. The positive impact from health coaching and lifestyle risks, that's also on screen, and they're just some of the measures that we take during our health coaching programme. Today, I just wanted to touch on the motivations behind why the NHS has been seeking to fully integrate coaching support within its provisions. There is growing research inside the UK and overseas highlighting those positive impacts on the adoptions of health behaviours, whether that is weight management, it's getting people outside more, cholesterol levels are going down, but it's also about someone's quality of life, what are they getting out of their day-to-day, and really then looking at patient satisfaction as well. It's why within our PMI service, for those diagnosed with cancer, we offer coaching support and around nutrition and fatigue management. In some NHS trusts, it's already used within managing some of the long-term conditions, as well as integrating care in the rehabilitation wards. There's also benefits more broadly. So we're seeing that clinical teams are reporting a reduction in clinical time needed with a patient because they're starting to feel that they can self-manage themselves a little bit better because they're feeling more confident. It's also starting to reduce some of the readmissions into hospitals. To conclude, one of the most important outcomes, in my opinion anyway, is that it can help people feel more in control and take responsibility for their own health, giving them the knowledge, skills, and the confidence, more importantly, to manage their condition in every setting, so whether that's work, home, or anywhere else. I'll hand back to Sarah to wrap up, and then she'll talk through some of the measures more broadly.
Thank you. Okay, I'm conscious of time, so we're just going to go back to the survey and actually probably end on a bit of a kind of a call for action in many ways. So this is around the data that our respondents to the survey said was most important at managing the effectiveness of their health and wellbeing spend. There's no surprise on the ones at the top to do with absence, management of claim data and engagement and wellbeing programmes. But as you've heard from what we say today, actually it's those that are highlighted at the bottom that we think actually we need to be much more comfortable in talking about as a community, both the employee feedback on those clinical experiences. So if you think about that PREMS data that I spoke about earlier and really understanding that and being able to kind of land that with your stakeholders, but also the clinical outcomes data, such as some of that Fran just spoke about, that really differs by specialty, differs by service. There isn't one unifying number like there might be in absence or engagement. But as a community, it's really important that actually we start to understand and use those measures if we really do want to deliver the impact of digital that we talked about earlier. So to bring us home, we've got sort of 4 key themes that we think are the takeaways that we need you to take today. Firstly, as employee benefit professionals, really think about that data-driven decision-making. And to my point earlier, beyond engagement, beyond absence, what are the metrics that we really want to drive to show the value of what it is that we're doing? And some of those outcomes are incredible in terms of what we're able to deliver. Really think about personalising your healthcare benefits. It's a big theme that comes out around how brilliant digital can be. It allows the right care at the right time for an individual. So how do we personalise and tailor those benefits so that actually they meet the needs? The third is around integrating care models. And as a provider, this is the hardest thing for us, right? We have some brilliant solutions that actually we need to stitch together. We need to make sure sit together. So outside of here, we're doing a lot of work about how our virtual GP service sits alongside those online outpatient services that I spoke about earlier, and how we then get the referrals into those diagnostic networks really, really working. When they all sit together, they work better. And then the last is to do with continuous feedback loops. The more data you have, the more timely data you have, actually the onus is then on us as a kind of community to come together and act on that. Do those continuous feedback loops and make sure that we're iterating those services to come together. So thank you for listening, and I think we've now got a bit of time for questions.
Join me in thanking Sarah and Fran for their really interesting presentation.
We're going to be on that.
I've got a good set of questions on Slido, but I'm also going to hand it over to the floor. If anyone wants to put their hand up, we can go old school as well. So do pop your hand up as well. Okay, I'll start with a Slido question then. It's got the most votes here. Have you experienced any legal claims where something serious has been missed by using a digital service?
So I think the point to note is it's not a digitally only service. So actually what this is doing is capturing the information to put it in front of a clinician to make that decision. And it's just about collecting it really effectively. So whilst I'm not in our legal team, none that I'm aware of, because ultimately what we're doing is making that clinician more effective. So it's not that there is a digital tool that can or can't miss it. Ultimately, we're still just putting the information in the hands of the right clinician.
I guess that's the benefit of the blended service. That
Absolutely.
Go between the two. Any questions from the floor? No? I'll go back to Slido again then. Prevention is featuring a lot in discussions around the NHS and economic inactivity due to ill health. Can you tell us more about health responsibility? What does this look like for employers and employees? I think there's a question further on down as well. It's also about how do you encourage employees to take health responsibility via the platform?
So one of the key elements really is actually looking at when can you help and when can, and I talked about earlier to, leading a horse to water. So it's making it available, and a lot of all the good stuff that you'll already do in terms of shouting about the services. And I think we can all probably shout more in terms of particularly around like EAP, for example, so your employee assistance program. Lots of people still don't know what it means. It doesn't really say what it says on the tin. Unless you're in this kind of sphere, it's not kind of easy to access necessarily without knowing that it means mental health. Really, when you're then looking at health responsibility, you as employers, it's really looking at, can you make the services available, and then actually encouraging employees to say, this is here, this is for you to access, it's easily accessible. You can take time out if you need to speak to someone during your working day. You can allow those extra bits of time so that it's easily accessible on their desktop, for example. That's kind of to do with the access, and really then it starts to say it's a more open conversation, and that starts people talking about health responsibility.
And then, where does the responsibility and liability of care lie? What are the risks for employers in providing such detailed support for employees?
I feel like there's a lawyer in the room somewhere, isn't there? There's definitely a lawyer in the room somewhere.
I'm sensing some nervousness.
Yeah, so if we take the example of HBS UK that we've acquired, they're CQC registered and they have a medical board. And ultimately, those services are designed by a panel of experts in their field with a chief medical officer. And they take that responsibility really seriously. Actually, when we were looking at acquiring them, we spoke to them around how they were engaging with the CQC. And actually, they said they were working with them to design what an appropriate inspection would be for a new service, because they were conscious that the service they provided didn't really fit in the boxes of, the CQC manual for going into a particular service provider and seeing what was appropriate and what was right. So actually the responsibility remains with the clinician, but the design sits within the organisation that is CQC registered, that has a huge amount of clinicians in there. So to put it into context, our panels for some of our service design include sort of 12 to 15 really leading experts in their field, and they spend months poring over those questions that are asked. Absolutely months, validating them, refining them. Quite often we go into the office now and someone says, oh, I've got the neurologists in today. They take this responsibility really, really seriously. So ultimately it's with the clinician, but the design of the service sits with an HBS that we have acquired, and they take their CQC registration really seriously.
I was going to say, healthcare is incredibly regulated by the services and also the professionals working within it. So I guess this is more supporting that side or facilitating.
Yeah, and equally, we have an opportunity to audit it and check it in a way that you just don't have in face-to-face care. Ultimately, all you get out at the end of a face-to-face care are the notes that someone scribbled on something that ultimately ends up in a system. The ability for us to look into particular things and work out actually if it is working or not working, or if a clinician is delivering a good service or not quite the service that we want, is night and day compared to what you have in a face-to-face setting. So actually we think it gives us a real opportunity to have a look and make sure that service is clinically safe.
I won't rely on Slido again. Any more questions from the floor? This lady here. Can you shout, or would you like the mic?
Yeah, we can hear you.
Yeah, my question is, so we have these things in place, like the pathways.
Yeah.
But the problem is employees may choose to go the traditional way. So what are your kind of best practice from your clients? What we should be doing to promote these so that we would have GPs use more than the traditional, call it virtual GP. I still call virtual GP as the traditional as well.
Yes.
It's opposed to the business as well. So what would be your suggestions on this?
So my first point would be to say it's hard, right? We do a lot of research into this space, and we got a lot of research debriefs. So we say, how do customers feel about these digital services? And the answer is often, it depends. It depends on who they are. It depends on what their issue is. It depends on all manner of other factors that are going on in their life. And I say that because that's hard for us as benefit providers to design something that fits for that. But actually what we found is the humanity behind it is really important. So reminding people this isn't a robot that they're speaking to. This is a very well-trained clinician. So things like putting pictures that you'll have seen on that health coaching app earlier of the person that is actually going to be looking at what you're doing, opportunities to see how well-trained they are and those kind of things. But equally what we find is the adoption curve takes a bit of time. Once people have used it and they see the value of it, they come back. It's the same what we saw with virtual GP over time. But you've hit the nail on the head with the bit that we are wrestling with the most in this. And increasingly, it's about that relational care and the humanity. You're not talking to a chatbot. Actually, what you're doing is providing information for a clinician to have a look at. And things as simple as putting a picture of the person who's going to be doing your case review actually seem to make a whole way kind of forward there. And then the other thing is just talking about the safety of what we're doing and all of the controls that are in place. But it is really hard. I keep wanting a real silver bullet in the research that we get back, and everything we get back says it completely depends on the circumstances of the individual. But probably coming to a question that I think is on the top of Slido, what we have found is actually you can't make assumptions as to who the people are that are really going to embrace these services and who aren't. And equally, you can't make assumptions to do with the severity of the issue they're dealing with and how they feel about it. So really early on in some of our digital design, we had a hypothesis that actually people would really embrace digital services for things like muscles, bones and joints that were seen as quite low acuity, but would never do so for something like cancer. And actually I remember sitting in front of a customer who said, no, that's exactly what I want, because I have just been diagnosed with cancer and I can't say that word out loud yet. So if you're giving me a solution that means I don't have to get emotional and say that, I want to use it for that. And that always sticks with me at saying you just can't make assumptions that someone of a particular age won't use it or someone of a particular background won't use it. It depends very much on the circumstances of the individual. Is there anything you'd add from your experience?
No, I was going to say you can't make assumptions is probably the key thing. We all assume that the younger generation is the one that are going to use it, and actually half the time they're not. Sometimes they think, actually, I'm young, I don't need to worry about my health. So actually you're seeing those kind of like later into life people actually accessing because they're like, oh, actually that could be something that is a problem. And really those health assessments, when people engage with those, actually you see them coming then through onto the platform because we all lose bits of paper and it just has everything all in one place. So you actually see that you move away from the stereotypes.
Brilliant. Well, thank you so much, Sarah and Fran. That was a really interesting, fascinating speech. And another plug for the report.
Stand 18. Yeah.
It's on, is it Stand 18? It's Axa Health. I know there was a batch there before. Get one before they all run out. And thank you. I think you've got 20 minutes now to take an opportunity to go around the various sort of stands. And then it's the next breakout session. Thank you very much.